Hi, I'm your host, Marsha Florence with Just Ask Talk Show. Today's show, ladies and gentlemen, is HAP is here. Everybody can join us. Hi, I'm your host, Marsha Florence with Just Dance. Today's show, ladies and gentlemen, is HAP is here. And we have a representative herself, Elizabeth Robinson, Medicare Outreach Developer. Good afternoon, Elizabeth.
Hi, Marsha. Thank you so much for having me.
Thank you for joining us. Now, Elizabeth, let me say something. You know, we said HAP is here, and we're really excited to have HAP here. so I want you to start off with telling us a little bit about yourself, your role at HAP, and hey, we got to find out, why is HAP here?
Well, sure. So HAP is here has been our tagline, if you will, for the last few years, and meaning that HAP is here in the community. We're a regional carrier, insurance carrier. So if you're not familiar with HAP, it stands for Health Alliance Plan. We are a regional health insurance carrier that is owned by Henry Ford Health. And we are based in Detroit area, kind of born and raised in Detroit, if you will. Our new slogan, if you will, is going to be HAP is Michigan's home for healthcare.
Okay.
So my role at HAP is to work in the Medicare sales department, and I have a lot of experience in finding ways to bring Medicare education to the table, to help people understand what to do, how to do, and when to do it surrounding Medicare, because it's an incredibly complex topic that a lot of people find very intimidating and very confusing. So I always say if it wasn't so confusing, I wouldn't have a job. But my job is to help people kind of navigate through that and understand how to make better choices for their healthcare and how to make the right choices and the best ways to approach the questions and how to sift through the choices that are available, because there's a lot of plans available in the state of Michigan. So we want to make sure that everyone's getting the plan that works right for them. And that's where I come in to help.
Okay, that was a mouthful. Okay. Well, you know what? I think the thing of it is, Elizabeth, is that people always get it a little bit confused. We have annual enrollment, which is October through December. Then we have open enrollment, which is January to March. And then we have special enrollment periods. Okay, so can we start off with something about open enrollment? What's the difference between all the three?
Sure. So annual enrollment, like you said, is the time every fall that comes up, October 15th through December 7th. Everyone who's currently on Medicare at that time can reevaluate and reshop and make choices for what they enroll in for the following year. So any enrollment that they have that they make changes to or they keep will take effect on January 1st of the following year. Open enrollment follows that. That's from January 1st through March 31st. And what the idea behind open enrollment is to allow people to make one course correction. So if whatever the plan is that they're enrolled in for January 1st, if they start to use it, find out that it doesn't work for them for whatever reason, or maybe they found a plan that works better and they wish that they had made that change during the annual enrollment period and they missed it, they have the chance to make one change to their enrollment between January 1st and March 31st. The date that they make the selection or the change, the plan will take effect the 1st of the following month. And that way they're not stuck in the wrong plan for the whole rest of the year. And that's different from a special enrollment period, which during the rest of the year, you would have to have a life qualifying event that triggers a special enrollment period that allows you to enroll outside of either of those two, the annual or open enrollment periods.
So the special means there may be something that's medically, a medical situation that may cause you to have a certain type of coverage?
No, it's not a medical issue. It might be
Okay.
because maybe you're retiring, you're over 65 and you're retiring, and now you're coming off of that employer-based plan. So you're losing that employer coverage. That's called a loss of coverage. It might be that you're moving from one area to another where there's different plans available.
Okay.
So it's a life event, not necessarily a medical event that triggers the special
That's
enrollment
good. I'm
periods.
glad. I'm glad you correct me on that because, some people say, well, I've got to have this surgery and this
Yeah.
insurance carrier doesn't cover that surgery. Can I switch now before it's too late so I can have this surgery?
Yeah.
So does that fall under any of the categories?
No, and the reason what the special enrollment period does is tries to mimic the special enrollment periods that are the life qualifying events that you might experience while you have an employer-based coverage. So if you're working and you have employer-based coverage available to you, you have your annual enrollment period that you can make your changes for next year. You can change your elections, whatever's offered to you, and that takes effect the first of the following year or the first of the next benefit year that the employer offers. Outside of that, you have to have something that triggers an ability to make a change to your enrollment during the rest of the year. So that's why they have the special enrollment periods available, because things do happen, but it's not medically driven.
Okay. Well, that's clear. That clears that up.
Sure.
All right. So people like to know that, I made a mistake in November or December or whatever. And I'm so glad it's the first of the year. I can go back in and change. Now, we do know in the month of October to December, that's when the agents call. The agents and the advocate call. Ring phone, ring phone, ring, ring, ring. Okay. And everybody like, I'm just bombarded by all these phone calls.
Yeah.
But the first of the year, January through March, we have to make the call to the company.
Absolutely.
Okay.
Absolutely. It's not something, the rules and regulations from the government say that the carriers are not allowed to, and the agents are not allowed to advertise and market to that piece, that enrollment ability, but we have the ability to provide the education about it. So that's why a conversation like this is helping people understand what is available to them without trying to sell them on a product.
Correct. So I tell you what we're going to do. We're going to take a break and come back with some more good information about HAP is here. We'll be right back.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
Honey, what I think you need is a socket wrench.
I played JV basketball.
I'm sorry. I don't think it looks right.
This is good, and it's all good, baby.
Is it really all good?
If you love me enough to routinely test your handyman skills, not to mention the strength of your marriage, then of course you'll visit nhtsa.gov/the-right-seat to make sure I'm in the right car seat.
I'm gonna call my dad.
Julie was always a voracious reader. She'd carry 2 novels on an airplane because she'd read one on a 3-4 hour ride. And at some point, I began to notice that she would read a page and couldn't remember what she had just read, and she'd have to go back and read it again.
I don't remember much these days after I read, but less does for me, and I love it.
And welcome back to the show. Now, ladies and gentlemen, if you're just not joining us, I'll always tell you, get your pen and paper out. Because why? You have questions. You have some questions, and you may have some questions for Elizabeth Robinson of HAP. So always remember, see our number at the bottom of the screen, 1-800-323-5336. Or you can email me, Marcia at Just Dance Talk Show. Or, I don't know that Twitter name, X, whatever, but you can always find us on our local stations and PBS Channel 56. So at any time you have a question about any of our guests, feel free to contact me and we will get that question over to them directly. Now, Elizabeth, we like to make sure that our viewers are comfortable in knowing that when a guest comes on Just Ask, that they can actually reach out to you and say, hey, I had a question, saw you on the show, feel like I can ask you a question, and that's important to us. To
Absolutely.
Make sure people, right, so I had a question that I'm sure somebody wanted to know. Well, I shouldn't say what is better, but what's the difference between Medicare Advantage and Medicare Supplement plans?
So we get that question a lot. Which is going to be better for me, Medicare Supplement or Medicare Advantage? Which should I choose? There's a lot of different reasons why one or the other might fit a particular person's needs. There's a lot of questions and a lot of information that needs to be considered. So it depends on if you're somebody who's on a fixed income, or if you're somebody who has a very small monthly budget to work with. Choosing a Medicare supplement plan might be difficult because of the higher premium versus a lower premium on a Medicare Advantage plan that might be available. But if somebody has a lot of health issues, a lot of diagnoses that require a lot of medical services throughout the calendar year, somebody might pay less out of pocket if they're paying the higher premium than if they go with a Medicare Advantage plan and the higher out-of-pocket copays. So it just depends on the particular situation, what's going to work best for that person's needs. And there's other types of insurance too. There's different versions of Medicare Advantage plans that go along with Medicaid as well. They call them DSNP. There's everything is an abbreviation in letters in the world of Medicare. So DSNP stands for Dual Eligible Special Needs Plan. So if you have Medicare and some Medicaid availability to you, then there might be a different plan that's available that could help you have zero out-of-pocket costs. So there's all kinds of questions that I can't highly recommend working with an independent, trusted agent, that they can help you sort through those questions and sort through the options and help you pick what's going to be best for you.
Wow, but that's a lot. I mean, when you're trying to make that decision on what coverage you need, but a family member is a husband and wife, they can have different medical coverage.
Absolutely. In the world of Medicare, there's the single beneficiary is ever on the contract. Whereas like a employer-based plan, you might have your entire family on one contract. In the world of Medicare, it's each individual. So like you said, a husband and wife or whatever the situation might be, each person can have their own plan. One can have a Medicare supplement, one can have a Medicare Advantage, one could have one with one company and one with another. So there's no need for it to be the same, although a lot of people find it easier to keep track of the details if it is the same. So it just depends on what works best.
Okay, and that makes sense. I'm like, hey, my husband doesn't like the coverage I have. He says, well, I'm going to get my own.
Yep.
He gets his own, hey, we both handle our own medical coverage, and that's it. All right, that will work. That will definitely work. Well, I know we have some photos coming up, some things that you guys have done and stuff. So we do want to, get into those photos. But before we get to that photos, a lot of times I just ask questions because the viewers at home are somewhat saying, I wish she asked this, I hope she asked this kind of question. So what kind of questions should someone consider while choosing a new plan?
That's a great question. So when you're comparing the plans that are available to you and you're making choice, especially during the annual enrollment period, things that you need to consider and you need to make sure that you're asking these questions and getting the answers to before you make that enrollment choice is, are the doctors that I want access to in the network of this plan? So can I go to my doctors? Can I go to the hospitals? Can I go to the facilities that I like? The second question that you need to make sure they ask is, are my medications covered by the formulary list, which is the list of medications that are covered under that plan? So you want to make sure that you're looking those medications up and checking the tier level, or if there's a prior authorization required or anything like that. The next thing I always suggest is making sure that you're taking a look at whether or not you want or need additional benefits. So like in the world of Medicare Advantage, there's added value benefits that come along. They have to do with dental, vision hardware, hearing aids, a fitness benefit, an over-the-counter benefit, things like that. Are those something that's important to you? The last thing that I always want to take into consideration too is, do you have any known changes to your medical needs in the next year that you're looking forward to? Do you know that you're going to need to have back surgery or a knee replacement or hip surgery? Or have you recently had a change in your health or a new diagnosis? That all of those situations, will your need for more medical services increase or change in some way? And that can affect the policy that you're looking at too.
That's a lot. That is a lot, okay? And you know what? And if you're an elderly person, you're not going to remember all that, and you don't know what to be concerned with. So if you have adult children who is helping you with your medical plans and everything, hopefully they would know to ask that. But if they didn't, they got to figure out how to come back to that. Oh, I forgot to check about Dad's hearing aids. Oh, I forgot to mention, Mom needs glasses. Can they come back through if they've forgotten something?
So my best suggestion is to work with a trusted agent, a local independent agent who work with all the different carriers, not just any one particular carrier. And that way you're getting kind of an agnostic approach to helping you look through and sift through all the choices. And the agent, because we live in the space of Medicare, we know the questions to ask. We're going to pull that out of you. We're going to ask you those questions, and we're going to help you to make those, identify those puzzle pieces, if you will, and then help you put the puzzle together. So working with an agent is a huge key to that. Other than that, just doing your research and trying to really think outside the box of all the questions that you might need to ask.
That's good. That's good. Okay,
Yeah.
so I want to go to some photos. I don't know if we actually have enough time, but we're going to capture a few of the photos of some of the things that you guys have done, over the year or
Yeah.
so. So there's our favorite sign right there. HAP is here. Okay, and that's a warm photo there. That is a very warm photo. So it gives headways to know that there's caring people, or people are peaceful with their decision and choice that they made for their medical coverage.
Yep. So this was actually some of my team members and I, we went to a food bank up in the Flint area, and we all volunteered and helped sort through some food packages and get things done so that we could contribute to the food pantry side of life there. So it was a really fun day.
Now, you guys have been around 60 years?
More than 60 years, yeah. That shirt's a few years old.
In your community for over, it says over 60
Yep.
years. Okay.
Yep.
That's good.
This is our CMO, Margaret Anderson, holding a check that we donated to the Detroit Public School System. We have, for a couple of years now, made a pretty significant contribution to the school system to find out ways that we could really impact the students and the community. So that's what that event was.
All right. That's what I'm talking about. Giving to the schools.
And another way that I personally find very fulfilling is to work with veterans. So this was on Veterans Day. We partnered with Mittens for Michigan and donated mittens to veterans in the area.
Okay. Well, I tell you what, so what we're going to do is go to another break and come back with some more of these photos and talk about more things going on with HAP is here.
There we go.
Okay.
You'll remember this day forever. You'll remember where you were. This day has never been closer. Today, thanks to your help, the Leukemia and Lymphoma Society is saving lives. LLS-funded research has led to nearly every blood cancer treatment available and is now helping patients with other kinds of cancer. At LLS, beating cancer is in our blood. Join us at lls.org.
And welcome back to the show. Now, ladies and gentlemen, I always get excited when I have guests. Why? Because I'm getting some resources for you as well as myself, okay? So, Elizabeth Robinson from HAP has taken the time out from her busy schedule to come and tell us about the HAP program and the resources that are involved with HAP, as well as some of the wonderful events and support that they have been done in the community. So we left off with some photos, Elizabeth, and I want to go back into the photos and get some more information about them, because a lot of people don't understand or see that. Well, how does insurance carriers get involved with the community? So you were telling us about this Veterans Affair right here.
Yep. So that was on Veterans Day. We were there. We partnered with Mittens for Michigan and sponsored them, giving out a pair. You can see in the bottom corner of the picture these really heavy duty warm gloves for veterans at no cost to them. So that was there. And then I was there to answer questions about Medicare, because that's what I do.
Okay, that's great. Okay, I'm sure people appreciate the mittens and or gloves or whatever have you. You know, a lot of people are not expecting those things, so when they get them, they're like, oh yeah, right on time.
Yeah,
Yep.
especially for winter.
Oh yeah.
And the Game on Cancer is one of the really big initiatives that that we do as a corporate fundraising event. We partner with Henry Ford's Game on Cancer, which also works with the Lions. So we are a major fundraiser for that program, which raises every single penny that is raised toward that charity is given directly to the cancer patients that it helps.
Oh wow.
So you don't have to be let me rephrase that. It is really an incredible process that helps people like who might be in financial need because they're going through cancer treatment and maybe they need transportation or maybe it's a choice between getting their chemotherapy or putting groceries on the table or paying rent that month or whatever the case may be. So there's a lot of really great help that comes out of that organization.
That is great. Wonderful, wonderful. Yep, that is great. I'm sure the families appreciate it. Well, I'm going to speak on this one myself right here. So you guys joined us for our 3rd annual Health and Fun Fair at Detroit's downtown Eastern Market this past October, and we're so grateful to have you guys. And your teammates had a wonderful time, so we have a lot of pictures to send back, but we're also grateful to have organizations to come and share information and resources with the attendees so that they'll know who does what and where.
Yeah.
Okay, so please thank the gentleman and the lady there for coming and joining us, and we hope to see you, this year too.
We look forward to it.
Okay. I had to get that out, ladies and gentlemen. and there's the famous HAP logo. So HAP stands for what again?
Health Alliance Plan.
Okay. And I always pass by the building in downtown on the boulevard. Is that headquarters?
So that was our headquarters. We've actually recently moved out of that building. We've sold it, so we're no longer there. Our actual headquarters are now at New Center 1 in Midtown. And then we have our Troy office, which is where most of us work out of. So.
Okay, I've seen the Troy office too.
Yep.
Okay, all right, so no more on the boulevard. All right. So what does it mean to be a regional carrier?
That's a great question. So a lot of people are very familiar with all of the national carriers out there. What sets us apart is that we are regional. So we're born and raised in Detroit. We service Michigan. We don't go anywhere outside of Michigan. We don't even cover the entire state of Michigan, especially for the Medicare. It covers most of the Lower Peninsula, 48 counties in Lower Peninsula. So it's a really different approach to, it's kind of comparing like a big conglomerate to a smaller, more independently owned company. We have boots on the ground here. We're highly invested in supporting our communities that we serve. Some of those pictures showed some of the events that we do locally to help. We volunteer with different organizations. Our staff volunteers man hours. We do fundraising for different initiatives like the Heart Walk, like the Crim Festival of Races in Flint, like Game on Cancer. So we're really, really invested in our mission, which is the health and well-being of the members and lives that we touch.
Wow, that's really great. But I did have a question, somewhat of like a personal question. If someone is taking care of their elderly parents or something, and the parents may have a mild touch of dementia, and they answer the phones, and they say yes to this, how can someone avoid potential scams? That
is such a great question, and really timely in the last few years. We've seen a real increase in scams that happen, especially amongst our older population. One of the really popular scams are unsolicited phone calls. So my biggest suggestion is to encourage everyone that you know not to answer an unsolicited phone call. Let it go to voicemail. If it's someone that's supposed to be calling you, they'll leave a message. The other thing that I will say is, just like the IRS, no one from Medicare will ever be calling you. So if you do answer the phone and they say, "Hi, my name is so-and-so from Medicare," it's a Medicare broker. They are trying to sell you something and trying to get you on that. The third thing, and the very most important thing, is that if you do answer those unsolicited calls, please try your best not to say the word yes. These are recorded calls, and if you do say yes, they can manipulate those calls and make it sound like you agreed to something that you didn't.
Wow.
And so what we see happening a lot, not so much at this time of year, especially during the annual enrollment period, though we do see it. It still happens all year round, but especially in the annual enrollment period in the fall, is that people will say, "Hi, is this Elizabeth?" "Yes, it is." Don't say that. Say, "How can I help you?" or "This is." So
Right.
try to avoid saying that word "yes," because what happens is that the other question that they ask too is to say, "Well, I understand that you have a plan that you really like, but can I send you some literature about my plan?" "Sure, you can send that to me." "Well, now you've agreed to something on a recorded call." And they take that call and they'll move you to a plan that works for them to sell without your knowledge or permission. And sometimes people, especially who might have the dementia issues or the memory issues, or might not understand what was being said to them in some way, they don't even realize that that this change might be happening until 2, 3, 4 months later. They go to use their insurance, and now it doesn't work because the insurance that they thought they have is no longer in place. There are ways to fix it, but I always say, highly recommend, if you don't have an agent that you're working with, if you do have an agent that you're working with, call your agent. If somebody's calling you, telling you something about your plan or something about your application or whatever, call your agent. They can verify for you. If you don't have an agent, call the carrier that you have your plan with directly, because they can pull up their records. They can see what communication might have been attempted. They can verify information for you.
Wow. Well, Elizabeth, you gave us a wealth of information today, truly, and I hope our viewing audience, will take heed to some of this information you gave us, because it's a lot, but as a caregiver, you got to know that you got to pay attention to everything that relates to a person's social security number, banking information, health records, all those things that come into play. You have to take note. You can't just say, "Well, mom and dad is fine over there." You don't even know if they signed the house away. Pay attention, people, pay attention. So I'm glad you filled in some information for people to really look into if the parents have filled out their own health, insurances. Did they pick out the right thing for them? And by it being the period that they can go in and make the adjustment or change, note that January through March is when you can make that change. So mama picked something that she shouldn't have had or don't need. We can get rid of that. Don't worry about it. We got to the first of the year. That's a plus. That's eye-opening.
Absolutely.
So I want to ask you, like I ask all my guests, but it's true. Will you come back and join us again?
I would love to.
Okay,
I would love to.
Well, thank you so much for your information.
Absolutely. And I would just encourage anyone to please reach out to me if you have any questions or need a referral to an agent. We have a lot of independent agents that we work with that don't work for HAP. They're independent, so we'd be happy to make that referral.
All right. We'll have that information in our credit roll. Thank you. Well, ladies and gentlemen, I always tell you, tune in. You never know what you're going to learn from Just Ask, and you can always just ask the question. That's the most important. 1-800-323-5336. Email me at Marsha@JustAskTalkShow. I'm your host, Marsha Florence at Just Ask, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.